Hello, hola, bonjour. I'm delighted today to open this Stroke Action Plan for Europe event for you. My name is Grete Lunde and I'm a board member of the Stroke Alliance for Europe. I work with the Norwegian Stroke Support Organization and I sit on the Stroke Action Plan for Europe Implementation Committee. I'm a stroke survivor and I had my stroke 27 years ago. I experienced a severe stroke, a cerebral sinus venous thrombosis. With the MRI showed that I had 4 blood clots in my brain blocking my veins. The doctors put me in an induced coma for 10 to 12 days. And when I woke up, I could only blink with my eyes. That was it. My arms and legs didn't function at all. My family was told that I most likely would die, or if not that didn't happen, I would probably be a vegetable that never would be able to sit, walk, or talk. After rehabilitation, my left side came to life, but my right side is still partly out of function. After 6 months, I was able to walk a couple of meters for the first time. And after 10 months, I was back to work full time. But after 10 years, my neck and back was painful, and I sadly had to stop working. Despite having a life with great pain and daily challenges, my life is mine, and I am me all day, and I love to live. My stroke has greatly impacted my life. There are over 9 million people like me living with stroke in Europe. This is why I'm passionate about the Stroke Action Plan for Europe. We must come together, stroke survivors, stroke support organizations, medics, allied health professionals, policymakers, to prevent stroke and to improve the care and long-term support of stroke survivors in every country in Europe. I'm excited today to hear about the progress that has been made towards implementing the Stroke Action Plan for Europe. Thank you for your attention.
Thank you very much, Grete, for this personal and excellent introduction, which really puts the focus on why we're here today. I'd like to introduce our first speaker today, Valeria Caso, former president of ESO, and one of those who conceived the idea of the Action Plan for Europe. Thank you very much, for Valeria, for being here today to talk to us about the SAP-E vision.
Thank you very much. So for those who are not familiar with the European Action Plan, I will give you an overview and what were our ideas when we designed this. Next, please. My disclosure, please go ahead. You know, this is the latest. It came out, I think, yesterday or the day before, about the national burden of stroke. And as you can see, this was my leitmotif during my presidency, that stroke in Europe has different impact. And especially going to East, unfortunately, you still see there's a higher impact of stroke compared to other countries. But still, you see there's a difference between France and Italy. Some parts of UK are different from each other. So the idea behind of this was that everybody in Europe, because we are focused on Europe, should have the same chance to get the best treatment for stroke. And for us, this was really when, for example, sometimes you hear stories from your patients that were on holidays and had a stroke outside the countries, and you hear how the access to stroke care was not equal. Now we have, luckily, NOACs and thrombolysis in the essential list, in the list of the essential medicine of the WHO, which clearly gave a push forward in treatment, in the treatment of our patients. Next, please. So, you know, this is just because I for those who are not so familiar, we divided the whole vision in what we call the whole chain of treatment. So starting from primary prevention, which was never included in our vision of stroke, but still I believe, and more and more working on stroke, that the best treated stroke is the prevented stroke. We can do, you know, the return of investment of prevention is so high. And even if you do the best thrombectomy, even if you do a wonderful thrombolysis, the patient will tell you that his or her life was before and after the stroke, even when we have success stories. So we have to work on prevention. We have to focus more and more on prevention. Then we have the organization, the management of acute stroke, rehabilitation, secondary prevention, very important, and the evaluation of stroke outcome and life after stroke. And you heard already how important it is. And Grete, I think, sharing her personal experience, shared you what it means to say, okay, I'm happy, I'm here, I want to live, but there was a moment in my life that everything changed. And then we have this translational research group. Next, please. Just to focus, what we wanted is, so the idea, the overarching targets is to reduce the absolute number of stroke by 10%. Doable, everything doable. And especially if you look, and I recommend you to read the Global Burden Disease report, how much the risk factors for stroke are preventable. Obesity, smoking, atrial fibrillation, hypertension are all risk factors that we can face. And unfortunately, if prevention does not work, we need to treat our patients in stroke unit in dedicated care, and we want to reach at least 90%. This is something, it's a must, because we know from Cochrane, we know from all our personal experience that this changed the history of our patient. And this cannot be done without a national plan for stroke, where we start from primary prevention to life after stroke. And we, as we are very ambitious persons working together, we want to have an implementation of all the strategies of public health intervention. And this is, you know, we can take 100 kilos of drugs, but if we don't have a healthy lifestyle, we will not have the same effect. And we more and more evidence from also from the global burden disease, pollution is one of the major leads to a major increase of risk of stroke. And this seems to be quite, let's say, in a way, not very quite banal, but everybody thinking about a tumor is thinking about respiratory disease. Unfortunately, also vascular disease is something that is involved. And again, poverty. We need to, it's clearly, we will as physicians not to say, we cannot change poverty, but we can say as physicians, look, if there is not a situation where we can we work against social deprivation, social isolation, then we will have a higher risk of stroke in our population. Next. So primary, I will not focus on, I just give you some of what I think the most important. Blood pressure, very important. For example, in the UK, we have this wonderful program. GPs, after the age of 45, start to measure blood pressure in their patients. Because especially in women, we know that women tend to be hypotensive until the age of menopause. Many of them find themselves hypertensive, so are not ready to, they are not even treated. Next, please. Organization of stroke service target, but I think this is something that we are, and I think it's for us a wonderful surprise that we see many of our in our countries. There's a stroke society, there is an evidence-based pathway, and there is also having a pathway in the stroke society who is monitoring clearly improve the quality of stroke care. Next. Acute, as I said before, we want to have treating more than 90% of our patients in a stroke unit. And we want to reach more than, in some countries are already there, like Austria, more than EVT rate above 5% and IVT rate up to 15%. Many countries are already there. We need that every of our European involved country reach there. And very important, I think this is one of the most important point, that we also need to face the challenges of intracerebral hemorrhage. Still, we know that intracerebral hemorrhage has the same prognosis than 20 years ago. So we need to have a good outcome more than in 50% of our patients. Next. Secondary prevention, you know that there is a lot to do in lifestyle advice, as I said before, to have all the investigational modalities to access, for example, access to all the investigational modalities. We are not talking about countries like Italy, Germany, everything is for free. But go to other countries where for every additional examination you have to pay. So, so it's very important that this access is free. Next. Rehabilitation. You know, in many countries in Europe, the access to rehabilitation is very limited, also often done by private hospital. We need to do more on this. Next. Outcome for us, what we say, and you will hear about more this after this from our colleagues about the key performance indicator. Very important. We need to measure our stroke quality because it's something that everybody is not aware how good or how not so good she or he is working. So we need objective key performance indicator. Next. Life after stroke. You heard. Very important, self-management, digitalization, and so on. Next, please. So, and we need a European framework on researching preclinical research, team science, guidelines for preclinical trials, and identification of new treatable targets. Next, please. So these are our deadlines. You know, you cannot have a plan without deadlines. Next. And this is for you, just to remind you that everything is done thanks to the collaboration of all the national societies, because ESO is based on the collaboration of all you all together. So very important, your presence. And I want to thank you for listening, and I hope that you take, after this webinar, you take the action plan, reread it, and see what you can implement in the future. Thank you very much.
And thank you very much, Valeria, for this excellent overview of the vision of the SAP-E. I just want to remind everybody that you're very welcome to ask questions. Please write the questions in the chat. And after the last presentation, we will go through all the questions together. And now it's my pleasure to give the word to the next speaker, Arlene Wilkie, who will talk about the Declaration for Action Plan for Stroke in Europe and the key performance indicators. Please, Arlene.
Thank you. Sorry, just get back to the beginning of my presentation. Thank you for the introduction, Hanne, and thank you to Greta and Valeria for their presentations as well. So, achieving political interest, why is this so important for us as the Stroke Action Plan for Europe implementation group? First of all, I would just like to introduce to you, if you don't know who the Stroke Alliance for Europe is, we are a not-for-profit organisation. We are the voice of stroke survivors. We represent stroke support organisations from more than 30 European countries. And our aims are quite simple: to reduce the numbers and the effects of stroke across Europe. So why should the Stroke Action Plan for Europe be of interest to our politicians? On screen here, I've just put up some quotes that we have heard from throughout Europe. Issues around stroke units and serious issues around what happens to our stroke survivors once we leave hospital, and the gap in care there. Second slide as to why politicians should be interested in the Stroke Action Plan for Europe, just following on from what Valeria talked about. Stroke is the leading cause of death and disability. It's a leading cause of death and disability. It increases, the numbers of strokes are increasing, and the costs of stroke care are going to increase as well over the coming years. There are disparities between countries in terms of the care they provide, and many countries don't have a specific or a comprehensive strategy for dealing with this. And the pandemic has only made the situation worse. I was on a meeting with Valeria last week where she talked about the situation. It was where people didn't want to come to hospital because of the pandemic. People who already were receiving stroke services because of their stroke, their services fell apart during the pandemic. And what Valeria and other physicians on this call are seeing now is they're seeing firsthand the increased disability levels and increased mental health toll that patients are now having because of the pandemic, because of the stroke, and because of stroke care. The time is now for our politicians to listen to our stroke survivors and to take action by implementing the Stroke Action Plan for Europe. So who's leading on this? I thought you might be interested to know who's working on this. It's the European Stroke Organisation and SAFE, as Martin said at the start. We have an implementation committee. Hanne is chairing it. Francesca and I are co-chairing it. And we have a committee of around 14 other people from across Europe who are doing some fantastic work on leading this plan. I've put the website address up there for you so you can find out more. So what are we trying to achieve politically? What is it that we want our governments to do in Europe? Well, we want each government, each parliament, each responsible body in Europe to have a stroke plan. We want funding for that stroke plan, and we want services to be audited. Now, why do we want that? We want that because we want to be able to show which stroke services are not meeting the minimum standards that you've set in your country. That will help you identify what needs to be done to improve services. It will help you plan for recruitment and training of specialists in your country. It will enable stroke support organisations to develop public awareness campaigns, and it will also help stroke support organisations understand what life after stroke care they should be providing as well. So it's really important that we get our politicians engaged and involved in this, because by implementing these plans, we will see better outcomes, fewer people will die from their stroke, and more people will make quicker and better recovery after having their stroke. So what have we been doing as a committee? For the last 18 months, we have been developing and supporting national coordinators in each country. We've been holding training sessions, information meetings, and out of the 52 countries, there are around 48 that have signed up to being involved, with 89 named coordinators. And on the side there, this is what they've been doing. They've been forming committees of physicians, allied health professionals, stroke survivors, stroke support organisations, politicians, all coming up with that clear direction of what is it they want to change in their country. They're making their voices known. They're holding press conferences, press releases, awareness days. And importantly, for my discussion today, they're working with their health ministries or whoever is going to be interested in working with them. And this is a really busy slide, and I must apologise, and I'm not going to read through every single point, but I wanted you to see it. So if these slides are shared after, you have the information. The first thing that we want to do politically is our declaration document. And you'll see there's been some chat about it in the chat already today. The declaration is a document that we are asking each country in Europe to sign. It is a document that signs up to the country implementing the Stroke Action Plan targets and recommendations that Valeria has already mentioned, and also a series of 12 key performance indicators, which I just outlined here. In summary, we want each country to have a stroke plan. We want each country to have a public awareness campaign. We want each country to have stroke care from the minute you go to that stroke unit to all the way through to life after stroke. Without this, we will not see improvements to the whole care pathway of those individuals that have stroke. As Greta said, the stroke doesn't just end when you reach that acute unit. It can last a lifetime. So this is what we have been doing. We've been asking our national coordinators to work with their countries to get the declaration signed. And we're really pleased to tell you that we launched this on European Stroke Awareness Day. We know it's been translated into at least 17 languages. We know that the Ukraine, Portugal, and Lithuania have signed the declaration. Congratulations. And we know that on World Stroke Day next week, Bulgaria, Catalonia, Belgium are working towards getting them signed next week. And we also know that Estonia, Italy, and Spain are working towards getting their declarations signed as well. I hope I have everybody's information up to date. If I've missed anybody out, please do put that in the chat for me so we can keep an eye and keep in touch with you. But there is still more to do, and you're going to hear more from Francesca and others after me now as to what's going on. If you are interested in knowing what is happening with the Stroke Action Plan, and if you want to get involved, please do look at the website. And of course, if you want to get in touch with me or know more about SAFE, there are some details there for you. Thank you so much for listening. Like Greta, I'm very excited to see this. I am absolutely delighted that we are involved in this and at the heart of this with that stroke survivor voice. I'd like to pass back over to Hanne for the rest of the meeting. Thank you.
Thank you very much, Arlene. The next speaker I have the pleasure of introducing is my other co-chair besides Arlene, Francesca Romano Pisella, who will talk about the National Stroke Plan and the template being prepared for that. Thank you very much for giving us the pleasure of hearing you here today, Francesca.
Thank you very much, Hanne, Arlene, Valeria, and everybody for the participation. So now we are talking about stroke national plans. In some of the European countries, this plan are probably already in place, but in many European countries, there are not full plans for stroke, or just some interventions have been programmed or put in place and are part of common health policies, current health policies. So among our initiatives, and you have heard already that there are different initiatives such as the declaration that we have been promoting and we are using to encourage and support the national coordinators. We are also trying to support national coordinators and the stroke European community with different tools. The Stroke National Plan template is one of these tools. Please, next slide. As you have heard from Valeria, to have a national plan for stroke encompassing the entire chain of care from primary prevention to life after stroke is one of our overarching targets. And of course, to implement fully the national strategies in the for a multi-sector public health intervention and approach to stroke patients and to stroke risk in European countries is definitely a need, and it's an issue that needs to be addressed. That's why we have been working together with Fabrizio Pennacchi, who belongs to the Italian stroke support organization Alice and is president of Lazio. We have been working together and we have developed a template. Next slide, please. This template that you can see here, just the first page, is actually a quite informative booklet that we suggest to use as a framework to support stroke prevention, care, and to use to build social policies at a national level, at a regional level, healthcare policies, healthcare recommendations for politicians. You will see that there are different boxes. Of course, to develop a stroke national plan, it's very important to know what is the current situation in the country, and so what is stroke care as it is at the moment, so the current situation. And we have prepared also questionnaires that you will be, the national coordinators and the stroke communities will receive in order to assess the situation in their countries. National stakeholders, so we have also prepared a stakeholders analysis and other tools that can, other managerial tools that can be used in your own country. Next slide, please. What we think is very important is that the measures that are within the stroke plan must have the effectiveness of government action and should be mandatory. So this is also very important, and that's why I really thank Arlene for her really excellent presentation and all the suggestions and the advice that she has presented to the stroke community that could be used in order to catch the attention of healthcare politicians and convince them, explain to them why it's important to talk about stroke even during a pandemic time as the one we are currently living in. And of course, in the stroke plan, a very important point are, as Valeria said, a plan is not a plan if we don't have a timeline and if we are not able to monitor results. So the importance of key performance indicators, not only of the stroke care plan, but of the plan itself. So it's very important that this plan, when is implemented by project managers, expert project managers that should work together with the healthcare policy makers, with stroke experts, and of course, with the representative of stroke support organization. Next slide, please. Another critical point is funding sources and distribution and how we do access to this funding. Each country has different situations. So we might have good suggestions for some countries, and we might have other suggestions for other countries. There is the possibility to access to funds that are offered by donors in different situations, or for example, in some European countries, there are recovery plans that are now available after the pandemic. And all these details are probably needs to be addressed by the local national coordinators together with the stroke support organization and together with other stakeholders that are interested and have possibly signed the declaration, so they are interested in promoting stroke care in their own country. Next slide. So I think, and this is, I think this is a very important point. So how the national teams should be structured. It's extremely important that the national teams that are guided by the national coordinators are structured, encompass all the stakeholders that are possibly interested and that could possibly support the implementation of the stroke action plan in Europe, in the single countries, and that knows the regional and the local situation and can impact on it. I think this is extremely important, and that's why we try to produce as many tools as possible and to help national coordinators to model these tools in according to their local situation. And the SAP-E committee, together with the SAP-E chair, Hanne, Professor Christensen, and Arlene Wilkie and myself, we are available for you, and we are ready here to help and to respond to your questions. Next slide. So this was just really a snapshot of what the stroke action plan could be. As I said, there is a document, a template document that is ready for the national stroke coordinator. So we are going to present it in another meeting to them, but we really hope this is one of the tools that will help the implementation of the stroke action plan. But as Valeria said before, what is going to change stroke care in Europe? It's the communities, the stroke community, which is not only made by physicians or healthcare workers, but is made by other stakeholders, by patients, by the civil society, which probably really play a major role. Thank you very much.
And thank you very much, Francesca Romana. Now it's my pleasure to introduce the next speaker, Professor Torsten Steiner, who led the work on compiling a list of what is really the essentials of stroke care. Thank you for joining us here today.
Thank you, Hanne. It's a pleasure to talk here to you, dear colleagues. Next slide, please. So why is this document, what was it made for? Actually, it should give you an orientation. It's meant to assist the implementation of the ESO action plan. It should provide an overview of evidence-based stroke care and treatment. And it's also there to highlight essential steps that define good basic stroke care. And this is meant from over the chain of stroke care, as you have heard by the speakers before. Next. What is it not? These essentials of stroke care are definitely not a guideline. They were prepared from guidelines, but this is not a guideline. This is more an orientation. Next, please. How did we come up with this document? First of all, there was a subcommittee built by or established by the ESO Guideline Board and the Stroke Action Plan for Europe Steering Committee. The people who were involved are Guillaume Turk, Jesse Dawson, Katrin Sunahagen, Hanne Christensen, and myself. And what we did is we took recommendations from high quality guidelines and translated these into a practical list. And when we did this, we first were choosing ESO guidelines wherever they give a recommendation. As you may know, ESO guidelines are since a couple of years grade-based, evidence-based guidelines. And in case there was no grade-based guidelines, we were looking for best existing guidelines or consensus statements. This document was approved first by the steering committee of the SAP-E and by the ESO Guideline Board and the executive committee. Next. The parts that are covered are running from the pre-hospital management to life after stroke. We graded these recommendations in must do, consider doing, and don't do's. We typed the quality of evidence by naming the different sources, which were evidence-based recommendations, systematic reviews, meta-analyses, randomized control trials, consensus statements, or research articles. Next, please. The aspects that are covered in these essentials of stroke care are pre-hospital management, measurements to be done on arrival of a suspected stroke, reperfusion, acute pharmacological therapy, acute stroke unit care, then rehabilitation, the prevention of complication and further workup, carotid artery disease, and then secondary prevention pharmacologically and non-pharmacologically up to lifestyle modifications. And then there are recommendations on things that should be done after discharge and on life after stroke. Next, please. I would like to give you two examples. Next, please. Here you see our what we think are the stroke essentials of acute reperfusion treatment, which is to measure blood glucose before intravenous thrombolysis, to perform intravenous thrombolysis within 4.5 hours, or the recommendation of reperfusion therapy by using intravenous thrombolysis or mechanical thrombectomy within 6 hours. And we also gave a recommendation on how to perform these two measurements in selected patients in the late time window. Next, please. Here is an example of what we are saying about life after stroke. So this covers aspects of follow-up, of support and education on driving after stroke, and participating individuals and counseling of specialists. It is on education, on support, physical support, on planning, care planning, and on what to do, summarizing after, or preparing a summary after the acute care of stroke. Next, please. Where do you find this document? You'll find this on the SAP-E homepage. There you click on resources and then on downloads. And under downloads, you'll find the points supporting documents released by SAP-E Steering Committee. And there you download then the SAP-E Essential Stroke of Care. Thank you very much.
Thank you very much, Torsten. The next talk is my own. So, well, I will go through the stroke service tracker system. Please, next slide. So why is a stroke service tracker needed? It refers, as Valeria also explained, to the domain in the stroke action plan called evaluation of outcomes and quality improvement. A stroke service tracker is useful to guide decisions by both identifying weaknesses and identifying strengths in what is actually, what is actually done. It's also very useful to support arguments for change because it enables comparisons over time and between countries in what care is actually given. And further, a stroke service tracker provides a continuous mapping of the status in Europe. Next slide, please. So just to give you an example, if this works, and there could be plenty of other examples from other countries, but it's just far easier for me to find data from my own country. So here I'm sharing the development in stroke in Denmark after implementation of a stroke service tracker program. This was implemented in 2005, and I here show the results in the years only from 2008 to 2018. And what we see here is that the basics of what is happening in acute stroke care, like stroke unit admission, antiplatelets, OAC, carotid imaging, swallowing test, revascularization, goes up during the time of implementing a stroke service tracker program, whereas mortality both for IS and for ICH goes down. And this does not, of course, not only happen because you record something, this happens because recording things is the basis of making change, because you identify problems and can follow them. Next slide, please. So when we started to set up a stroke service tracker program for SAP-E, we looked at what should be the prerequisites for an efficient and feasible model. We were certain from the start that it was important for feasibility that we ensured a minimal workload for the national coordinators. It was also absolute needed that we avoided GDPR issues when involving 52 European countries. It had to fit with the different systems of healthcare that are found in Europe, and it had also to be made fit to the individual countries, because countries are not the same. The countries' challenges in relation to stroke are certainly not the same, and one size does not fit all. So it was based on these preliminary discussion of prerequisites we started to make this program. Next slide, please. So as to data, we will only collect aggregate summary data, which could be the total number of people with stroke. In that way, there's no GDPR issues. And basically, we do not need single patient data to look at the overall situation of stroke care. So we think this is a very good solution. We're going to collect a few basic data, including like the number of people with stroke, the number of stroke units, and things like that. And then we're going to focus on key performance indicators, the 12 key performance indicators, as was presented by my co-chair Arlene earlier in this webinar. Next slide, please. We're also going to record what are the data sources, and that is because the availability of data sources will vary significantly between countries, and thereby quality of data. But if we only want the best quality of data, this will counteract improvement, because good data often comes with improvement of care. So the solution we've chosen is that the data sources that are used will be declared. And if there are no data source, no registries to go to, it's possible to make an estimate, but it has to be stated that this is an estimate. We're also going for having documentation on the things entered into the stroke service tracker, like if a country states that they have a national stroke plan, then they have to upload or give a link to the national stroke plan as a documentation that this actually exists. We have worked hard on making this documentation part of it as feasible and not cumbersome as possible. Next slide, please. And how will we present data? When we're going to present data, it will have overall two different audiences. One is for decision makers, for the public, which is where everybody without having a medical degree or other degree should be able to go in and see what is it like. So this is what can be used for advocacy, for presenting data for the decision makers in the individual countries. The other part of it is that we will also make data available that are more detailed, so that the healthcare professionals can go in and get better to the depth, the details of what this is about. We're going to use two types of graphics to present the main results, and they will be presented all at the SAP-E website. We're going to use column diagrams ordered by value, as when we're going to give things that are numbered, like that could be the number of strokes or the number of stroke units, or other things, the number of patients receiving IV thrombolysis. And the other way we're going to do it is by color coding of a map, where we can give the countries colors based on whether, like, they have a national stroke plan, that would be green, or not, that would be red. Further, the more detailed data on the countries will be found by clicking on the country on a map, exactly the same way as you probably already know that we use for looking at the national coordinators, where you go to the website, you click on your country, and you can find the representatives of your country. Next slide, please. The data is uploaded annually, and a unique link will be provided for the NC, and activity is logged. When the data is available, we estimate that uploading time will not go beyond 60 to 90 minutes. But of course, if you have to look for data, it will take longer. If you're very used to uploading this kind of data, the time will be shorter. On an annual basis, this data will be audited and benchmarked at an individual country level in order to discuss how is the status now, and should we move our benchmarks, and what are our actual focus points. Next slide, please. The status at the moment is that the system has been set up and is in beta test. We're very grateful to Estonia, led by Yannicka Koff, who has already gone through this process, and now in Greece, Giorgio Trigoulis and his team is going through this. It's a massive help for us. We're going to have first circulation for 2020 data by the end of 2021. And from 2022, data is to be uploaded after first quarter. That means that last year's data will usually be available at this time. Next slide, please. Thank you very much for the attention. The next item on the agenda is that we will have the panel discussion based on the questions that you, our audience, will pose in the Q&A section, and this will be moderated by Fischer. Please feel free to ask any questions. I think it would be nice with a lively discussion.
So first of all, thank you very much, Hanne, for this excellent and great presentation, and also your leadership for this program. I think we cannot be more than thankful what you have done in the last few years for this whole project. Without your enthusiasm and your persistence, we wouldn't be here. The same also to Francesca Romana. So let me start with the first question. It's by Carolyn Watkins. Should ESOC be developing partnerships with non-medical associations in different countries? And I think this is a question which you could answer, Hanne.
Yes, certainly. As it is in the SAP-E, we are closely collaborating with the stroke support organizations in all countries. We think it is a basis of making change that we have a strong involvement of stroke support organizations. Healthcare professionals, we can give recommendations, but those who are living with the stroke or living with a relative who has the stroke are the ones who can make the demands.
Thank you very much. I would also like to ask the same question to Arlene, because Arlene is also very much involved in this topic. And as you see, this is an extremely important partnership between patient organization, medical professional organizations. So I think that this link is extremely important.
I completely agree with what you're saying, Urs and Hanne. As part of that collaborative events in countries, we need to make sure that the allied health professionals, as well as the physicians, as well as the stroke survivors, as well as the politicians, are all part of this collaborative group. I completely agree with the point that I think we should all be working with other professions as well to make sure we are doing the best job we can. So completely agree.
Thank you so much. My next question is going to Valeria. Valeria, the action plan has been designed already now 4 or 5 years ago. So when we started to think about this project, in the meantime, we had a pandemic, we had a lot of other challenges which we had to face. And sometimes during such a long period, there are different objectives, there are different things which are going to change. Do you think the main questions, the main targets of the stroke action plan are still valid? Or we already have to think about refining some targets?
Thank you. This is really an excellent question, because it seems that these 2 years, everybody of us feel that everything was standing still. But we learned also that stroke care is even more important than ever, because now we see patients who were not treated for 2 years. We know that prevention was not, there was not enough prevention. There was more diabetes, not very well, good lifestyle. So we know that absolutely we need to carry out our action plan. Pandemic, we know now that our, let's say, future we will face, it will not be the last one, but we have to work that we have a pandemic plan, that every time there is a pandemic, stroke care should go on like business like usual. Absolutely no question. Stroke is too important not to be put at a second point.
So we could, to summarize, we could even phrase the stroke action plan is more needed than ever, even before the pandemic. Okay, yes. Great. My next question is going to Francesca Romana Pezzella. You were a pioneer in with the National Stroke Plan. Please, what are the biggest hurdles? What are the biggest challenges you are facing currently?
Thank you very much for defining me a pioneer. Maybe because of the country I started visiting in the past, but what I think is maybe one of the biggest challenges is the participation. As I said, we need to be successful. We need a very high level of participation.
We currently have a connection problem. I don't know whether Francesca Romana still can hear us.
Yes, I can hear you.
Okay,
yeah.
So you're now back. We couldn't hear you for about 10 seconds. Could you please restart?
I will, yeah, just to answer your question, probably what we need most now is participation and engagement, not only from the stroke care community. So this is, of course, physicians, healthcare workers, and even the patients, but the civil society as a whole, so other stakeholders. And we need to establish alliances with other possible stakeholders, which is, of course, other professional communities or other, you know, without going political, but in trying to get the attention of policymakers, of healthcare policymakers at the European level, at the national and at the European level. Thank you.
So, but sorry for asking again, but aren't they all busy now with the pandemic and with COVID? So how can we get their attention despite the pandemic?
I think maybe we can get their attention because of the pandemic, because one of the lessons that we learned from the pandemic is that when we focus too much on one health problem, like was the COVID problem, we probably start losing the attention, and we lose other, our engagement with other NCDs, which are extremely important and are responsible for premature mortality and disability in Europe. And this is one of the reasons also why the WHO has recently called for a group of experts to work on a new roadmap in order to accelerate and push on the Sustainable Development Goal number 3, which is exactly reducing premature mortality due to NCDs in Europe. And I think this is probably the most important lessons that we learned from the pandemic. Strokes doesn't stay home. I mean, having COVID didn't stop the stroke pandemic in Europe.
Thank you so much. I would like to remind you that there is the chat function where you can put in your questions. Quite a lot of them have already been answered, so you also have seen some of them being answered. I do have a question to Thorsten Steiner. Thorsten, you were putting together the essentials. I think it is quite a challenging job to say what is essential, and is the essential enough, or should we do more?
Yeah, many thanks. It was a challenge, but with the help of others, for example, like yours or Hanne, it was finally done, because it's not my own work or the work of this subcommittee who decided what is essential or not. It was seen by many people who thought this is, let me put it as a framework or the minimum that needs to be done.
Okay, good. Thank you very much. There is a question in the chat from Javier Rodriguez. Do we have a specific objectives and strategy for the subacute phase approach of stroke at the European Union? This is a question which I would like to ask Hanne and probably also Arlene. And I think it's a very good question because we are talking all about the acute phase. We are talking about life after stroke, but also a little bit the subacute phase falls in between. And so what are the strategies?
This is an excellent question because we have been working very hard on the acute phase because we have had new treatments recently. But as to the prevention, which is what I understand, or perhaps more like the rehabilitation, the early rehabilitation, this is part of the stroke unit approach. This is, of course, included in the action plan, but I completely agree that this is something which needs far more attention. As for the SAP-E, it is covered by the key performance indicators, and therefore will be included in the national stroke plans. But this is certainly something which needs to be lifted on a European level.
Arlene, what is your comment on that point?
Just a final comment from me, then I'll hand back to Hanne, so we can close down. I think, yes, no, I completely agree that we do need to work harder at the whole care pathway and making sure that the whole care pathway is covered. And I know in recent meetings with national coordinators, it's been remarkable for me to hear people saying that they want to focus on the rehab and life after stroke side of things, and the prevention side of things. I think that is absolutely fantastic to hear. And we as the implementation committee will work even harder to make sure we deliver the tools that the national coordinators need to help implement this in their country. Hanne, back over to you.
With these remarks from Arlene Wilkie, it is my pleasure to hand over the word to Diana Wong. Diana Wong is from Portugal. She is a stroke survivor and will end up this session by giving her account of this.
Thank you, Hanne. I am delighted to close this Stroke Action Plan for Europe event for you. I would like to thank all the speakers, all the SAP national coordinators, the health ministries and policymakers from across Europe for the work they have already done to improve stroke care across Europe. My name is Diana. I work with the Portuguese Stroke Survivor Support Organization, Portugal AVC. You can find us on the internet. And I am on the national team who is working with the Portuguese Stroke Scientific Society to implement SAP in Portugal. I am truly delighted to let you know that in my country, Portugal, has already signed the Declaration of Support for the Stroke Action Plan for Europe. I am also a stroke survivor since 2011, and rehabilitation has been quite a journey with ups and downs, but I consider myself very blessed. I managed to get up again from bed, learn how to walk again and do things by myself. And even I had my third child 3 years after my stroke. Like Greta, who opened this event, I am so very passionate about advocating for others. Stroke does not just stop when we leave the hospital gates. A life saved must be a life worth living. I am excited about the progress we have heard too, and look forward to hearing more from the group in the future. Thank you all for listening. Take care and goodbye.
Thank you very much, Diana, and goodbye, everybody.
Okay, thank you.